In this issue of Data Bytes, we delve into innovative strategies and data-driven solutions aimed at achieving equitable health outcomes. We'll discuss the importance of comprehensive data analysis, how thoughtful and well-designed technology can advance better outcomes, and how these tools can be leveraged to identify and address disparities in healthcare access and quality. The kids are not all right, but they could be. Recently, the Biden-Harris administration issued a press release discussing how state policy impacts young recipients of Medicaid and CHIP. For an in-depth discussion of how pediatrics poses a special challenge in health equity, watch our interview with Dr. Sandy Chung, Medical Director of Informatics at Children's National Pediatric Health Network, CEO at Health Connect IPA, and 2023 AAP President.
The other piece that I think is a challenge in pediatrics is what's the definition of value? Mm-hmm. You know, often when we think about what we're doing for kids, we know that in early childhood, so when a child is even under 3 years of age, we learn so much in the field of epigenetics and so forth, where we know if we intervene early and we prevent things like adverse childhood events, if we mitigate trauma impacts, all of those things, that we can actually change a child's physiology. We can change their genetics so that they may not get chronic disease later when they become adults. We have data that shows that if we intervene early, we can prevent things like cancer. We can prevent things like diabetes. We could prevent things like obesity. And if you think about that, if you were able to prevent obesity, cancer, diabetes, all of those things, the trajectory of the healthcare costs goes way down. Absolutely. In the long run. But that return on investment isn't in a 12-month period, which is where a lot of payers are operating. Yeah. That payoff is going to be in decades.
Soaring costs, high healthcare stakes. As costs rise for both healthcare organizations and patients, the impact can be staggering. Healthcare expenses now rank among the leading causes of personal bankruptcy. Learn what industry leaders can do to lessen the burden and increase access.
I will challenge that, though. I mean, if you go back to the 90s, we had statin drugs. That was a huge crisis. You know, everyone was going to statin, and it was going to bankrupt the entire country. And you know, how are we going to tackle that? It's the same thing that's happening now with the obesity drugs.
Mm-hmm. Yep. No, it's true. It's true. It's maybe not novel. It's there are some jaw-dropping drugs out there though now that I think we haven't figured out what the like burden on state Medicaids are going to be.
Yeah, I mean, there was an article about how all of the Eli Lilly and Novo Nordisk are lobbying Congress to get all these GLP drugs on the Medicare fee schedule.
Right.
And you have this big push-pull of, you know, you've pharma, which is multinational and for-profit, and you've got Medicare, which is a government, and you have a drug that could dramatically improve the quality of life for consumers. And the real question is, how do we pay for it?
Yeah.
Right. And commercial and others aren't paying for it.
Right.
So here's another, creating disparities, health disparities, right? Because
Absolutely.
of access, lack of access.
In the article, they talked about how one of the biggest problems with these drugs is Americans are flying to Mexico to buy them in Mexico. And that's depriving Mexicans who really need the drugs, who have diabetes or are overweight, and they can't get them because we're coming and cash paying. Mm-hmm. And so not only do we have healthcare disparities in our own communities, we're then trampling across borders and creating healthcare disparities in other countries that have a much worse healthcare system than we do.
Payers equal power players. You might ask yourself, where do payers fit into this complex health equity equation? Here, we look at 7 ways insurance organizations can contribute to improved health equity, from cultural competence to exploring the value-based care model. A hot-button issue during wildfire season. During the Oregon wildfires a few years ago, our friends at Umpqua Health attempted to mitigate some of its members' air quality challenges by distributing a small number of air purifiers. To determine who should receive an air purifier, Umpqua used the Arcadia platform to identify who was clinically at risk for respiratory complications by accessing the Respiratory Risk Report, which predicts an individual's future risk based on past events and claims data. Once identified, they used Arcadia's Engage functionality to notify members through a text that they qualified to receive this device and how to get it. The devices were then distributed through their transitional care clinic to their members, and they had community health workers deliver some of them to homebound members. You can read more about how Umpqua Health partnered with Arcadia to assist its members who were impacted by the Oregon wildfires by providing them air purifiers. And that wraps up this edition of Data Bytes. You could check out the video description for additional resources, and also sign up to receive this newsletter directly to your inbox. To see more of how you can harness the power of data and analytics to drive healthcare innovation, request a demo of Arcadia's powerful data platform.